on the show tonight. COVID cases are surging in Europe once again, sending alarm bells ringing across the world. As per the WHO, cases have been mounting across 61 European countries. Of the 3.3 million cases reported across the world, 2.1 million come from Europe alone. Now, the world is watching the European surge with caution, and so is India. What's worrying is that the spike in cases come despite a robust vaccination program in Europe. Countries like Germany, Netherlands, France and Austria have fully inoculated more than 60% of their population and are yet witnessing a huge spike. So what does this really mean for India? Just recovering from a debilitating second wave. Should India brace for the third? Will we also be hit with a Europe-like COVID spike? With no definitive clarity on how long the immunity lasts, whether natural or acquired, is there any room for complacency now?
You're watching the News Hour at 10, debate number 2 on Times Now, Super Prime Time.
We have with us Dr Naresh Trehan, Chairman and MD of Medanta. Also with us live is Dr NK Mehra, who is the former Dean of AIIMS and an honorary emeritus scientist with the ICMR. Thank you so much, doctors, for joining us this evening. I'd like to come across to you first. Dr Trehan, what does this really mean for us in India? We all saw what the second wave did. We were all fearing the worst during the holiday season when the markets were crowded, but we were all perhaps a little confident given the fact that there has been a reasonable amount of vaccination, at least in the big cities. But now, given the fact that over 60% countries with over 60% vaccination are seeing yet another surge, Germany with its largest ever, what does this mean for us here in India, and what explains this surge in the first place?
So it's very obvious that the virus is still around, and also we must know that what is happening in the rest of the world can affect India the same way like it did in the past. The gap of 32 weeks between the first and second wave, and in between we thought we had actually gotten rid of the virus, and there was a lot of euphoria about it. Then of course it hit us like it just knocked us off our feet, and the whole country suffered hugely. Now the point right now is that we are in a lull period. Things have been, the second wave has been fading slowly with a fat tail, and we are down to 11,000 a day. But if you look at our experience in the hospitals, there has been an uptick recently. What we are seeing is that if there were 0 admissions in the hospital for a period of time, that in the last couple of weeks that we have now seen 6, 8, 10, 12 patients being admitted. But also that a lot of people come and they get tested and that they're positive, or they get monoclonal antibodies, but then can be treated at home too. So it's not that it has gone away, it is that we are hearing about more and more positive cases, and I think it's time to be extremely cautious for 2 reasons. One, the wedding season is on. There are large gatherings happening. The holiday season traveling is on. Now we are opening up with Europe and all other countries. Travel will be free all around. Absolutely. So I think that if we are cautious for the next 2 months, and it doesn't come in any way or form, in significant form, then we can relax, I think. By the end of January, we will be clear whether the third wave is coming, whether it's come and it's flat, or whether it's done the damage like it did before. So I think it's time for extreme caution. Don't throw away your masks and still practice the COVID behavior.
Okay, very important. There's no room for complacency at all, Dr. Mehra, as Dr. Trehan has said. But, you know, many would say that is it just complacency, the lack of following adequate protocol? Is there a possibility even that there could be new variants that we're looking at over here in Europe?
Well, at the moment, there is no evidence of a new variant. But I think what we need to do in India, and looking at the situation in Europe, as you know, if you look at the second wave, if you look at the first wave, India has been about 6 to 8 weeks behind. So does that mean that we will see a similar surge in January or so? I don't think at the moment there is any evidence of that, because there is no new variant seen. But what we need to do vaccines, and we have done very well in terms of the vaccination. My worry is that still there are 18 crores of adults who have not got control on the new variants there. and we have to keep maintaining the virus appropriate behavior actually, because so far we have done well. As you know, that the festival season in India began last month, and until today we are recording only about 10,000, 11,000 infections or so, but this can really, this situation can change drastically. And the fourth thing that we have to make sure is keep the transmission level to a very low level there. And so far there's no indication, but Europe has really gone through, if you look at the situation in September, we had been saying that countries in Europe who have been fully vaccinated, beyond 60% or so, they're doing extremely well, even though the infections are going up, but the death rate is not going up. But now we are seeing it's like a third wave over there. For example, if you look at the data in the last week, 500,000 cases are being seen in North America and Europe together. And that's the cause of worry. Will we see a similar wave in January in India? Because we are 6 to 8 weeks behind the scene. I don't know. I don't think, my hunch is that we will not, because if you look at the number of vaccinations that we have done and look at the data from the Sero survey, I think a lot of our people have already developed what we call hybrid immunity.
Okay.
People who have got the natural infection and they have also got the vaccination there. This leads to
both immunities are there, certainly. Yes, let me take that question across to Dr. Trehan. Dr. Trehan, one of the important points is that several of these European countries had reopened with COVID passports, as we all know. Only those who were fully inoculated were allowed beyond their borders. But the challenge then is that how do you ensure that those who are inoculated do not mix with the population that is not inoculated? That is a very, very big challenge. Now, as India is opening up and India is talking about allowing foreign tourists, who have been fully vaccinated, particularly for European countries which are seeing this wave, isn't this a very huge challenge? What can be the possible precautions that we can ensure on ground that the kind of numbers that we're seeing in Europe are not replicated even as we allow foreign citizens on our soil?
So you take the case of UK. UK has got the maximum vaccination. I mean, the whole population, very large proportion of vaccination is double dosed. In fact, the boosters have also been started. They are reporting 45,000 plus cases a day. For a population of that size, if that's the magnitude of the infections, it just waves a very big red flag for us. That in spite of the fact that you're vaccinated, yes, we know that there is some protection. Yes, we know that the number of people who will need to go into the ICU or are actually dying will be less because of the vaccination. That's the experience that shows. But it also shows that just the fact that you are vaccinated 2 doses, that you will not get infected again. Now, again and again, we are surprised when we see people who we know have been vaccinated, and then I just heard the other day from a friend's office, 6 people tested positive together. So that means there was one super spreader who spread it to everybody. So I think that there are 2 things that one should be cognizant of. Anyone who says, I know what's going to happen, is actually shooting in the dark. It's basically nobody has that foresight or the knowledge to say how this virus will behave. There are mutations all over the world. I mean, we know what's in South Africa, Brazil, all these places have different variants. The only thing that we can take some consolation from is the fact that what Europe and UK are seeing, and it is said that its majority is Delta variant. Now, Delta variant was a very significant part of our second wave.
Okay.
So it is that we have developed some immunity to it, and Delta, even if it comes from outside,
well, let's certainly hope that's true, sir. Let's certainly hope that we have developed that immunity. It would be a huge boost and certainly a huge relief to citizens here in India. But very, very quickly, let me bring Dr. Mehra, before we have very little time left, but there are some who are correlating the fact that we saw a similar surge last year in Europe. Do you think at all this could have anything to do with the weather? Because some are saying that this could possibly be, there's a conspiracy theory, of course, at the moment. There's no scientific evidence to prove so, that this could perhaps be associated with the weather. Is there anything at all that could indicate that, in your view?
This issue has been talked about several times, and I don't think there is any scientific evidence to prove. You remember that last year when we were we were seeing the first wave, or at the beginning of the infection, people were already talking about, oh, let the summer come and the virus will go down. There was nothing of that sort. There's nothing of that sort in terms of the cold as well. So I don't think weather has any role to play.
All right, Dr. Mehra, Dr. Trehan, I'd like to thank both of you for joining us and certainly sharing some very, very valuable insights on this very, very important issue. And the message is very clear. The top doctors in the country are telling you this, viewers, that COVID has not gone away. Vaccination is only one layer of protection, continuing to ensure social distancing, continuing to mask up, and to ensure that in no way you leave any possible spread of the infection. That's the most important thing. We have to continue to break the chain. Restrictions will continue. It is uncomfortable for all of us, but the fact is we have to bear with it if we have to defeat COVID. I'd like to thank all of you for joining us this evening.